If you find yourself stuck, lost treating cash pay patients and don't know how to structure a session, or maybe find yourself with extra time or more time that you thought, and maybe you've been used to insurance-based care or what they taught you in PT school, and now you're trying to work with more cash pay patients and you're stuck. What do I do with all this extra time? I'm used to 30 minutes or 15 minutes or 40 minutes. What do I do in an hour? If you are, this video is perfect for you. My name is Dr. Garcia. I'm the CEO and founder of a cash-based company in San Diego, California. I've been able to scale to 3 locations, and I'm here to share some easy tips on how to structure your follow-up sessions, your initial evaluation. It really doesn't matter, but ultimately how to do it differently than what you've always been taught in PT school or what you've learned in your clinical practice, maybe through insurance-based care. And this is the usual struggle, and you'll probably find yourself in this. If you have, say you have 60 minutes and you're used to a 30-minute session, you might go quickly through objective measurements. You go through a subjective history, and then you go through objective measurements. Maybe that subjective took you 5 minutes, then your objective measures took you another 5 to 8 minutes. You're now at 13 to 15 minutes, and you are ready to go on to Therex, because that's what you're used to. You didn't have the time, the freedom, and all these other things. So now you give them your 20 minutes of Therex, and they're still at 35 minutes, and you're like, well, what do I do with this next time? So you're like, well, I'll just see you next time, Mrs. Jones or Mr. Johnson, whatever your name is. And that's where most people get stuck. You're like, what do I do with this extra time? I'm not used to it, and more Therex doesn't equal more help. And there's a lot of internal struggles that people have. They're like, well, I don't want to do manual therapy, and I want them to become reliant on me, and I want them to have independence, and blah, 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 those things that you've kind of been taught or, been pushed into you. And so I think that the struggle becomes you have to give into a little bit of manual therapy. You have to give probably a little less than Therex. And I'll show you my framework on how I structure a 1-hour session. But before I do that, I think you have to understand, what is the intent, what's the purpose of a treatment session. It's to understand the patient's wants and needs, and you're just trying to figure out, okay, here's what they want, and then you're the wizard, you're the solution maker, you're the person saying, you know what, I understand what you want, here's what you need. You have poor hip mobility, you have poor running form, and you're working out too infrequently, and you need to up that. So here's the 3 things that I want you to work on. And that patient says, that's fantastic. What are you doing for me now to help me get through this? So you do some manual therapy, you do some correctives, and that makes them feel better. Then you still have to figure out, okay, great. Now until the next time I see you, how are we gonna help you manage these symptoms on your own? And when you structure a session, most people finish by the 40 minutes. Now here's how to break this down a little easier. From the 0 to the 10 minute, that's where you're really going to listen to them. Listen to everything that they've been struggling with. You just keep asking the question, what else? What else? What else is bothering you? What else are you limited to? Just keep asking that question until they say nothing. So they might say, my back has been feeling tight, and then you quickly jump into it. Oh yeah, it's because your erector spinae, your hips, blah, blah, blah. You're jumping the gun. They have more behind that. They have more struggles they want to share with you, but you're not used to being able to do that. So the easy way to say is keep asking, what else is bugging you? What else? Your hips, your neck, your shoulders, everything else. Because there's probably other things that have been bugging them that you can help, but you're so focused on the back pain, and it'll probably all tie in together. Give them 10 minutes easily. Then from there, you're going to do into your 3 to 5 minutes into objective testing. Go through some movement assessments, figure out what's lacking. So you're at the 15-minute mark. You haven't even put on the table yet. Perfect. Describe what you found. Spend 2 minutes describing what you just found based on their history. You said your neck, your shoulder, and your back are tight. Based on that, I just saw you move, and these are the 3 things that I saw today. That's what we're going to target today, so that you don't have to struggle with those when you're working out, whatever your problem was. From there, you're now going to get them onto the table, do your 10 to 20 minutes of manual therapy, all the magic that you've been taught, all the thing that separates you from everybody else. And from there, so let's put you at, that's already 42, 45 minutes. From there, you're going to get 10 minutes of therapeutic exercise, right? You're going to give them 2 to 3 exercises, show them in detail, why they need these things and whatever it is. We may create a video, give them their program. You're at the 55 at this point, or the 50 or the 55. This is where you're going to summarize everything. And you're going to say, hey, I understood that at the start of the session, your neck, your shoulder, and your back have been bugging you. We also found that you've been limited with your hamstrings, your hips, and your neck rotation. We addressed those inside the manual therapy, and then we gave you 2 exercises to help you with that this week. You're going to do those exercises twice a day for the next 5 days straight. I will see you on Friday, and you will have a follow-up. We'll go through this all over again and ensure that you're on the right track. What you've did is you've done a sandwich. You've understood their problems. You showed where you saw them inside the movement. You corrected them. They now have homework to do, and then you sandwich that. So if you are finding yourself just going straight into assessment, a quick subjective, and then now you figure out you're only doing a little bit of therapeutic exercise, it's only because that's the framework that you started with in insurance-based care or PT school. Get away from that. Create a better sandwich. Lengthen the subjective. You have to be able to tie in all their functional limitations into their life limitations. From there, that sets up a good framework to help the customer, the patient, understand why they came to you and why they should continue to come back to you. So don't feel lost. This is very normal, especially with new or cash-based PTs who are struggling to be able to translate insurance-based care into cash. And it's a very different framework. So take this with you. It'll make it so much easier. If you have any questions, put them down below inside the comments. But I'm excited to help you in your clinical practice of cash pay patients and beyond.